Hello, this is Dr. James Camp from Lee College in Baytown, Texas, and I'm going to talk a little bit about some integrative concepts in the endocrine system today. Now that we know the working of individual glands and hormones, it's time to see how they work together. There's an old Chili Peppers album called Blood Sugar Sex Magic, which I think could, just as easily describe the workings of the endocrine system. But there's actually one other thing in there besides blood, sugar, sex, and magic, and that is stress. Okay, humans, especially at this time in our history, find ourselves under a lot of stress. So let's talk about how the body handles its stress response by taking a deep dive into what's called the General Adaptation Syndrome, or GAS. Okay. So gas begins with a stressor, and that can be either physical stress or psychological stress. Okay, many of us find ourselves under physical stress at this time in our history. As I record this, we're dealing with the COVID-19 outbreak. Some people are physically stressed by the virus itself. Others, a lot of my former students work in healthcare, and they are physically under stress right now as they try to deal with the increased demands on our healthcare system. Many of the rest of us are under psychological stress. I'm trying to rapidly convert all of my course material to online teaching, which is a psychologically stressful endeavor. Many of you are learning to take online courses for the first time ever. That is a psychologically stressful endeavor. Any of these things is going to activate your body's stress response via activating your hypothalamus. Okay. The first stage is what we call the alarm reaction. Okay. In this, the sympathetic nervous system in specific points at specific times and the adrenal medulla over the whole body release the hormones epinephrine, which will abbreviate epi here, and norepinephrine, which will abbreviate NE. Okay? If you've ever taken or known someone who's taken an EpiPen, that's the same thing, epinephrine. It's a stress hormone. Epinephrine triggers fight or flight reactions for a few minutes to a few hours. It does not last more than a few hours in the bloodstream. If you've ever heard of someone having that quote-unquote adrenaline rush, adrenal and epinephrine are the same thing. They're just a Latin versus a Greek name, so you could just as easily say it's an epinephrine rush. This is that feeling that your attention is hyper-focused, your body is on high alert, everything is ready to respond to a physical stressor as quickly as possible. This doesn't help us all that much with the psychological stressor, except that it does focus our attention and concentration in much the same way that ADD medications like Adderall or Ritalin focus our attention and concentration. So it is essentially, stress is the ultimate ADD medication. These hormones also cause the liver to break down glycogen to raise the blood glucose level. So they have a similar effect to another hormone we've read about in this chapter, glucagon. Okay. Now, I often like to ask my students, so in which stage of the General Adaptation Syndrome do you break down food efficiently to give yourself fuel for a stress response? The answer is none of them. Okay. you would think the alarm reaction would want you to break down your food very quickly and efficiently, whatever's currently in your digestive tract. But in fact, your fight or flight hormones depress your digestive activity. They shut down your digestive system, prioritizing sending blood to your muscles, your heart, your lungs, your brain, things that are necessary for absolute survival in the minutes to hours after a physical stressor. Now, I like to talk about this in a couple of contexts. So one of them is that a physical stressor, and again, a lot of my students work in healthcare, so let's say there was a major emergency crisis like a hurricane has just swept through, or if you live in other parts of the country, maybe a earthquake or something like that. But a major natural disaster perhaps has happened, and there are a lot of people who are injured and need to be treated. They're going to call up all units of the EMS that are available in the area, activate them all, send them out on assignment. The first thing that happens when they get that assignment is an alarm reaction. Okay, they go into extreme hyper alert, their bodies are on high alert, their minds are on high alert, their liver starts breaking down glycogen to fuel them because they're shutting down their digestive systems during that time. So even if they wolf down a power bar or something on the way to their job, they're not going to break it down very efficiently because they're in fight or flight mode. The other thing I like to say is a psychological stress. If you're watching this, you're probably a student. So let's say you just found out that there's an additional final project necessary for your class that you have 2 weeks to do. Okay, you go into high alert right then and there. Your brain starts thinking about how you can rearrange your schedule so that you have time to do this project. Your epinephrine and norepinephrine start flowing. You're in your fight or flight reaction. Okay. Believe it or not, at that time, you're going through all the same reactions that you would if there was a physical stress. It's just a psychological cause. Okay. After, the alarm reaction, as we said, happens for minutes to hours. Okay. Sometimes stress continues longer than minutes to hours. Okay. Sometimes it doesn't. Sometimes the physical stressor is you have to get yourself out from in front of an oncoming car. Okay, you get away from that within minutes, or you don't. In which case we're rushing you to the hospital. But if you do, the alarm reaction goes away, and you never go into the resistance phase. You've completed the stress response. But in both of the cases that I mentioned on the previous slide, we've got an additional phase called resistance that's going to take place for days to weeks. Okay. And in this case, because you're not digesting food efficiently, because your body is prioritizing all of its stress responses, your glycogen stores are going to be depleted. Okay? Stress is going to use up too much fuel for your body to keep refueling, even if you are, wolfing down carbs or something. So the adrenal cortex is going to release glucocorticoids, the most famous and important of which is cortisol. Okay. These have the effect that gluconeogenesis is increased in the liver. You can break that word down. Genesis is the formation of something. Neo means new. Gluco refers to glucose. So we are making making new glucose. Okay, so the formation of new glucose is increased in the liver, and that's why these are called glucocorticoids. But also happening at the same time are lipolysis and protein breakdown into amino acids. Okay, lipolysis forms free fatty acids, which can be broken down through beta oxidation to power mitochondria in your muscles. Okay, or fatty acids can be converted into ketone bodies by the liver that can go on to fuel other parts of your body. Amino acids are broken down everywhere, and they're used as a short-term fuel source in any mitochondria that can get them if there's not enough glucose around. Now you might say, wait a minute, lipolysis, I'm losing fat. That's a good thing, right? I mean, I should be stressed all the time, or I am stressed all the time. Why am I not losing weight? The fact is, the stress response does not actually make you lose weight. It frees up fatty acids in some places, but it actually increases fatty acid deposits in other places that you don't want them. And at the same time, you're losing protein. The protein is being broken down all over your body, including those muscles that are necessary to fight the stress response. And at this same time, the immune system, and particularly its inflammation responses, are also being suppressed. And that's why glucocorticoid analogs are such commonly used drugs in the market, is that sometimes we want to suppress a patient's inflammation. Cortisone, or its artificial version hydrocortisone, is a common over-the-counter medicine for taking care of minor inflammations like bug bites or things like that. The prescription medicine prednisone is an artificial glucocorticoid that suppresses major inflammations like rheumatoid arthritis flare-ups or colitis flare-ups or anything like that. And there's a glucocorticoid called dexamethasone, which is an even stronger alternative to prednisone that's not used very often for anti-inflammation, but has turned out in some clinical trials to be useful as an anti-cancer drug. Okay. So let's look at our two base cases that we talked about. If you're talking about the emergency workers going to try to treat patients who are trapped in damaged homes after a hurricane or an earthquake or something, they have spent hours rushing into homes, pulling people out, getting them on stretchers, stabilizing them, getting them to someplace where they can get better treatment, wherever there's a hospital that's open. But those hours turn into more hours and more hours. Most emergency workers work like a 24-hour shift, so those hours turn into a day, and in one case of a major hurricane that happened here in Houston, these people ended up working several days in a row, okay, without adequate rest to get them out of their stress response. They maybe took breaks, but they weren't good enough breaks to get the cortisol levels down. So during this time, their body was depleting all of its glycogen. It's not digesting food appropriately. So cortisol is in high levels in their blood, making gluconeogenesis happen, making lipolysis happen, making amino acids break down, and also suppressing inflammation. Now you may wonder, why on earth in a stress situation would you want to depress your immune system? But let's say I'm dragging somebody out of their house and I scratch my leg against their, some sharp object that's been, some sharp corner that's been created by the storm or something like that, and I get a scrape on my leg. The last thing I want right now is for the inflammation response to swell that up into a big lump that I can't move very effectively. So I want to suppress that inflammation. And the assumption your body makes in creating this resistance reaction is that it's not going to last that long. Okay, you might have a couple of days of stress, but then you'll get a chance to rest, and at that point the immune system can clean up. Or if you're the student who has the emergency of the emergency stressor of an additional paper or project or something that you have to work on really quickly, again, that's not going to resolve in a day unless you're really incredibly efficient. So probably your resistance phase is going to kick in. Your glycogen is going to start depleting. Your cortisol is going to come up. Gluconeogenesis, lipolysis, amino acids, all of that is going to happen to try to get your body through to resist the stress. Okay. But what happens if it goes on too long? When days turn into weeks, weeks turn into months, at some point, depending on what level of stress you're under, you hit a wall, and that wall is called exhaustion. Okay? The exhaustion phase, sometimes called stress exhaustion, happens generally after weeks or months. In the case of the Hurricane Ike first responders that I was talking about in my first example, it actually hit around 4 days. Okay, these people had been working for too long, too hard, and the ones who had not been taking appropriate breaks because they just had an incredible work ethic, a big drive to help people, they started collapsing. Okay, they actually literally fell down on the job out of stress exhaustion, and they had to call in other rescue workers to rescue the first responders. In the case of the student, it probably takes weeks. You get to the point where you've hit the end of the semester, you've turned in all those papers, you've done all those final exams, and you go home and you collapse on the bed. If you're lucky, you haven't quite hit the exhaustion state yet, and your body just handles the exhaustion phase by knocking you out for 18 hours and restoring your body to homeostasis. If you're not lucky, you've pushed past that point and you're in a real exhaustion phase. At this point, fat stores are depleted and important proteins are broken down. Okay? When you start losing protein from major organs, those organs can't work effectively. The body becomes progressively weaker, muscle wastes away. In extreme cases, protein depletion, organ failure, or lack of glucose to the organs or various other such things can cause organ failure or even death. There are people who have literally died from stress. On the other side, prolonged suppression of the immune system can lead to disease. Okay, this is a more common thing for that second situation, the student or the person who is coming up against a big deadline in their work. Oftentimes I find that the week after the semester is over, when I filed all my grades and everything is gone, I lay back, I rest, and my immune system comes back online and says, oh my God, look at all the stuff that's in your body right now. And I feel sick for the rest of the week. So this is definitely a real risk of living in a stressful time. The best thing we can do is follow the advice of stress professionals. Take breaks periodically. Don't let a stressful situation last for days at a time. Break all of our big tasks down into small tasks that we can complete in a couple of days at a time, and then take a little break, rest, and let your body return to homeostasis. The Jewish religion has this actually written into our laws that once every 7 days we take a Sabbath. We take a complete break from work to let our bodies regenerate. I suspect if everybody in our country did that, and there was a time when people did, but these days with pressures from everywhere around us, we often work right through Saturday, right through Sunday, and we never take that break that our body needs. Okay, so that's my preaching on the stress response. The rest of this is talking about general endocrine integration, and there are about 10 situations that you need to be aware of for 10 to 12 situations that you need to be aware of for knowing how to integrate the endocrine system for your exam. Blood glucose, both high and low. Blood calcium, both high and low. Blood pressure, both high. And remember that the low is not a simple feedback loop like all the others. It's the RAS, the renin-angiotensin-aldosterone system. And of course, blood hydration, the ANP or the ADH system, antidiuretic hormone. On the other hand, there are more complicated body responses to basal metabolism, maintaining basal metabolism through the thyroid system. Oh, I put low blood pressure over here. Okay. Long-term stress, the need to grow, growth hormone, puberty in the male, puberty in the female, and there's one more here actually, which is the menstrual preparation in the female, knowing how the body produces progesterone to get the uterus ready for pregnancy once a month, and then loses that progesterone and begins to menstruate. To give you this practice, I provided on your Blackboard site a set of endocrine control maps. And they look rather like this. They're actually, this is a primitive, earlier version of the thing. They look a little bit more sophisticated than this now. But I'm going to show you how to do a simple feedback loop pair, and I'm going to show you how to do a more complicated thing. So let's look at regulation of blood glucose, because that's something that most people can relate to pretty easily. So increase in blood glucose level, decrease in blood glucose level. The control center in both cases are the islets of the pancreas. Okay, but the signal hormone is different. In the case of elevated blood glucose, we all know this hormone. The hormone is insulin. Okay, that's what every diabetic has to shoot up with after they've eaten a candy bar to get rid of all that glucose. On the other hand, in the case of low blood glucose, the hormone is glucagon. I like to say that you go for glucagon when the glucose is gone. Okay. The effector organ, in both cases, one of the effectors is going to be the liver. Over here, we also have muscles. And in both cases, we also have adipose tissue. Okay, I should mark liver in a different color. Here, let me make liver purple. Okay, and the response in the liver and the muscles is store glucose as glycogen, which is going to remove glucose from the blood, which is going to decrease our blood glucose level. Okay, so decrease blood glucose level. So that makes this a negative feedback loop. The response in the adipose tissues is to store glucose as fat. Okay. Over here in the high In the low blood glucose level, the response in the liver is break down glycogen, which adds glucose to the blood. And in adipose, it's break down fat, which can add fatty acids to the blood, can add ketone bodies to the blood if the liver decides that's what's necessary. Okay, these both increase blood glucose level, which again makes this a negative feedback loop because these are the opposite. The response and the initial are opposite. Okay. The other kind of control map that I've given you in this packet is a cascade map, a signal cascade map. And we're going to talk about, there are several hormones that use this. We're going to talk about the thyroid pathway, coordination of basal metabolic rate. Okay, so let's say that you're undergoing a really cold winter. Your body change is low basal temperature. You're feeling low energy all the time. So your body needs to respond by increasing your metabolism. Burn more fuel to give you more energy and more heat in your body. Almost all of these multi-hormone cascades, the renin-angiotensin system being the exception, start with the hypothalamus. Okay? And the hypothalamus is going to release a releasing hormone. In this case, it's thyrotropin releasing hormone, TRH. The second hormone in all of these systems, again, renin-angiotensin system being the exception, is usually the anterior pituitary, or ant pit for short. Sounds like an awful place to have a picnic, right? The anterior pituitary is going to release a tropin, a tropic hormone. In this case, that's going to be thyrotropin, also known as thyroid stimulating hormone, or TSH. Okay? Thyroid stimulating hormone, as the name suggests, is going to go to the thyroid gland, and it's going to release a pair of hormones, T3 and T4, which are really two variants of the same hormone. T4, I think, is the more stable form. T3 is the more active form, so they're sort of actively interconverted between each other. The 3 and 4, by the way, indicate, in case you haven't learned this already, the number of iodine molecules that have been incorporated in that particular hormone. Okay, so triiodothyronine and tetraiodothyronine, which is also called thyroxine. Okay, I'm going to write thyroxine down here because the artificial form, levothyroxine, is an important drug that we give to people who have hypothyroidism. Okay, the final target organs in this case are most tissues in the body. Okay, any tissues that are actively metabolizing are going to respond to thyroid hormone, and they're going to increase their basal metabolic rate. That's the rate at which they burn fuel to make ATP when you're not exerting yourself in exercise. So that's your ATP production rate, your metabolic rate when you're sitting back on the couch watching Netflix or something. Okay, there are a couple of feedback steps here. As T3, T4 build up, they feedback negatively somewhere here, and negatively impact how much TSH you're releasing, okay? In other words, your basal metabolic rate does not respond very quickly. So in order to keep from ramping up more TSH and more TSH and more TSH while you wait for the thyroid hormone to kick in, we're going to directly suppress release of TSH. This has the interesting effect that it's very easy to figure out if a patient's thyroid gland is damaged, because they'll have a low thyroid hormone, but they'll have a high TSH. That the TSH is coming in, it's sending the signal, please release more thyroid hormone, but the thyroid gland is not responding to it. If there's something else in your body that's the problem, say the hypothalamus is the problem, you'll have a low TSH and a low thyroid hormone, and that's called secondary hypothyroidism. As increase in BMR goes up, that responds negatively to the original body change in the first place, and this whole system can wind back down to its normal level, or at least stabilize at a level that keeps you at the right body temperature and the right energy level for that climate. Okay. All right, so that's how you fill out a endocrine cascade worksheet. Most of them are a little more complicated than this. They have more than one target organ, or sometimes the tropic hormone has direct effects on the body in addition to being a tropic hormone. So, try to figure them out, and I'll be available to help you on our Blackboard Collaborate session. Okay. Finally, I've given you an endocrine card game to finish out your endocrine system with. Take the gland cards, the hormone cards, and the target cards and put them out in separate piles. Then you'll get a stack of endocrine problem cards. Go through those one at a time. Line up every gland, hormone, and target involved in solving that problem in the order they occur in the body. So if the problem was low glucose in between meals, you'd line up the pancreas organ card, the glucagon hormone card, the liver target card, and an action, a response card that says break down glycogen. Okay. On the other hand, if my problem was one of the problems I have on there is time for a growth spurt. So here you'd find the hypothalamus card, growth hormone, releasing hormone, the anterior pituitary card, releases growth hormone. It has effects directly on bone and muscle, telling them to grow, and it also goes to the liver to make hormones called IGFs, which go to most organs and cause cell division. Okay. Okay, so that's a more complicated one that you'd have to work out. Now in class, I would do this as an actual game, a race, and the team who solves the most of these problems by the end of class wins with an extra participation point for each. In our current online learning situation, you're just going to have to do these for yourself, and you can send me pictures of them to see if you got them right, and I'll tell you thumbs up or thumbs down. Okay. If you think you learned something from this video, leave me a like and tell your friends about it. And good luck with your studying of the endocrine system.